сайн байцгаана уу? За тийг байгальмаа гэдэг. Би хүүгээ эмчилж тархины хагалгаанд ороод тэгээд одоо цэцэрлэг твийн эмчилгээ хийлгэж байгаа. Тэгээд Sarvodaya эмнэлэгдээ бүх эмчнэрт совилогч нартаа миний өвөг ийм эрүүл сар болгож өгсөн та нартаа маш их баярлалаа. Хүн талархаж байгаа хэрхээлээ. Та бүхэндээ ажилд нь амьдралд нь сайн сайхан бүхнийг хүсэн өрөөё.
Pediatric brain tumors are the second most common childhood malignancies after leukemia. 1 in every 4 pediatric brain child is diagnosed with brain tumors. Hello everybody, I am Dr. Neetu Singhal. Today I am going to talk about one of the rarest tumor in pediatric group. So this is the story of Master Munkh Orginal. So he is a 7-year-old small naughty child, and he presented to us in 2021 with history of headache and giddiness. He was evaluated by our neurosurgeon, and there was a posterior fossa lesion which was diagnosed as a pineal gland tumor. He was operated upon that lesion, suboccipital craniotomy was done, and excision of tumor was done. Histopathology was suggestive of high-grade papillary pineal gland tumor. He was advised post of MRI which showed some residual disease, and he was advised radiation therapy. Due to logistic reasons, he could not take radiation therapy then, and now in 2023 he came to us for radiation therapy. So when patient came to us, we evaluated the patient, and patient was a healthy child, very naughty, very witty child, and we could really evaluate the patient well. MRI showed a small residual disease about 4.3 centimeters, and we discussed the case in our tumor board, Uro-Onco tumor board, and decided to give him radiation therapy. So when we saw this patient, because he was a foreigner, Mongolian boy, he was a small boy, 7-year-old only. So we anticipated that we would come across a lot of resistance and uncooperation from child's side. So we had to really counsel him well, and because there was a language problem, we had to use Google Translator and some sign languages, and somehow we could convince the patient, and we were managed to start radiation without sedation. You know, usually such small children are given sedation for treating with radiation therapy, because radiation therapy requires a still position while the beam or radiation is on. So patient was convinced, and he took the treatment without anesthesia or sedation, and he received about 28 courses of radiation, during which he was healthy. He used to interact with us with whatever language he could communicate. And thanks to our staff also, who was very, very warm and cooperative with him. So this pineal gland tumor was treated successfully, and we discharged the patient a couple of days back. Little bit about pineal gland tumor. Pineal gland is a small endocrine gland which secretes hormones melatonin, which is responsible for our sleep cycle. So this gland, when it is affected with tumor, of course, this kind of hormones is disrupted and the sleep cycle is disturbed. And treating a small tumor, tiny tumor in such a small child is really challenging, because we have to anticipate the long-term side effects, the treatment-related toxicities, morbidities. So our team of physicists and technologists, they did a wonderful job by planning it so well and executing it as well, and we could really treat the patient well and discharge the patient. Patient is now healthy and doing well.